a baseball player, a volleyball player, a tennis player, or a worker who does a lot of overhand reaching, then you may be common for injuries of the rotator cuff. This region right here in the body is where the rotator cuff is located. This is the humerus, this is the scapula, and these are part of the intrinsic muscles that make the rotator cuff work. The muscles of the rotator cuff are the infraspinatus, the supraspinatus, the subscapularis, and the teres minor. This is another view of the rotator cuff and the bones and the muscles that complete it. Here you have the clavicle, the acromion, the rotator cuff tendons, the humerus, and the scapula. And you see the location in the body right there. These are common injuries that can occur with repetitive overhead motion during activities such as basketball, volleyball, tennis, and work that requires you to do this forward motion like this. So common injuries are a rotator cuff tear, which is when one or more of the tendons actually completely detaches from the humerus head. A shoulder impingement or a rotator cuff tendinitis would be from overuse of wear and tear in the tendons, and that would result in some mild discomfort to severe pain. And then you have rotator cuff bursitis, which is where the bursa that allows for the gliding motion of the shoulder is irritated and becomes inflamed and also causes pain that can be mild to severe. If you're an athlete that I previously mentioned, like a volleyball player or a baseball player, or you regularly perform work that requires you to do an upward rotation of your shoulder, then you may be at risk for a rotator cuff tear, which is when the tendon detaches from the humerus. It's very common for small tears to happen in the younger population, which usually can be resolved with taking things like ibuprofen and Motrin and resting your shoulder appropriately. If you're over the age of 30, you're more at risk to having a complete tear in your rotator cuff and have to have surgery. Along with a complete rupture of the supraspinatus tendon, there also may be problems occurring in the subacromial bursa and the glenoid labrum, also with the head of the biceps brachia. There are two different types of tears. An acute tear is if you fall on your outstretched arm and have a little heavy jerk or something that causes the tendon to have a slight tear. A degenerative tear is when you have a slow progression over time of overuse and compact tears, and it'll just keep tearing. If you have a degenerative tear in one shoulder, more than likely going to be your dominant shoulder, this gives you an increased chance of having a degenerative tear in your other shoulder, even if you have no pain in that shoulder whatsoever. Degenerative or chronic tears can be caused by repetitive stress, like I said before, but also it can be caused by poor blood supply and or bone spurs. And poor blood supply is a real problem because that's not going to allow the tendon to heal on its own, which could be partially why surgeries happen with severe tears. The symptoms that occur with this would be pain initially at nighttime when you're sleeping on the shoulder, and it may feel better in the morning, it may not, and then progressively throughout the day and throughout days past, your shoulder will continue to hurt and it'll go down your arm, and you may have some weakness, and when you move your shoulder like this, you may hear crackling. Management of these mild symptoms, such as small pain and a little swelling and tenderness, can be hopefully cured with anti-inflammatory drugs like ibuprofen or Motrin, and your doctor may give you a steroid injection to help with the pain and swelling and stuff. But if you have persistent pain and loss of function in this shoulder, then your doctor may give you an x-ray or an MRI. And the MRI will help the doctor decide if it would be in your best interest to have rotator cuff surgery. And in the surgery, they would go in, hopefully with a small incision, and actually reattach the tendon to the humeral head. Here's a picture for you to see exactly where the tear is going to happen if you're not very familiar with the anatomy of the body. So here's the humerus right here, like I've said before, and here are the tendons. And this is where the tear will happen. and it could be in one or more. And if your doctor decided that it would be best for you to have surgery based on your MRI results and your x-rays, then it would take you about 3 weeks in a sling, and then you will have a prescribed amount of physical therapy for your shoulder. And the amount of time is going to be different based on your age, your health, and how long the doctor thinks it's going to take you to actually recover from this major surgery. I know everyone's worried. If you're an athlete, you want to know if you can play in the next season, and if you're a worker, you want to know when you can start back to work again. But it's going to vary depending on the severity of your injury and whether or not you had to have an actual surgery. Rotator cuff tendonitis, which can also be called rotator or shoulder impingement, is also known as a painful arc or swimming arc, just based off where it happens in the shoulder body. It can be caused by forceful overloading from external abduction, flexion, extension, medial rotation. In rotator cuff tendonitis, this is where the pain will originate. And this is where the tendon is inflamed from the overuse from whatever you were doing. Other signs and symptoms that will occur will just be initial pain within the shoulder while you're sleeping maybe, and then it'll worsen throughout the day and as you perform more movements. There also can be numbness, weakness, and burning, and pain potentially can travel down the arm. If you're suffering from tendonitis of the rotator cuff, you would need to restrict your movement completely. So you would need to decrease external abduction, forward rotation, and medial rotation of the shoulder. Your doctor may tell you to take a non-steroid anti-inflammatory drug like ibuprofen or Motrin, and you would need to do small exercises of your shoulder that your doctor would specifically instruct on how you should do those. And you should initially start with cold therapy, so a bag of peas, a bag of ice, lay it on your shoulder for about 15 minutes, and hopefully that will relieve some of your distress. And then eventually you should work up into move to heat therapy, moist heat therapy. So your physician or athletic trainer or someone can advise you on the best ways to stimulate a moist heat therapy situation. And I'm sure most of you are curious as to how long you'll be out with this injury, and it can range just based on the severity of what you have going on. If you have a mild to moderate exercise movement routine going on, that's very good. Your physicians can help you initiate those. And then after about 6 weeks of doing a moderate to mild level, you should bump it up a little bit and see if you have any pain starting. If you don't have any pain when you increase the severity or increase the level of your activities, then you're probably going to be good to go and can continue your normal daily routines. If you do have pain and discomfort occur again, then it would be best to be re-examined by your physician. Rotator cuff bursitis is when the bursa here and the subacromial space becomes irritated and bothered by things like playing volleyball, doing some type of manual labor. And you can also see a picture of it right here, a more deep level. But this pain right here, that would occur right here with the bursa, is associated with the gliding motion of the shoulder. So whenever you would perform a gliding motion, you would have increased pain in this area and continue to disturb and bother the bursa that's right here. If you're suffering from subacromial bursitis in your shoulder, you would have symptoms such as severe pain during the throwing motion of the shoulder, point tenderness, and the inability to sleep on the affected shoulder. Your doctor may give you a corticosteroid shot. He may tell you to ice your shoulder, and the doctor at this point will need to make sure you don't have a tear or impingement or other things that could be disguised as just bursitis. And if it's actually, in fact, just bursitis of the rotator cuff, you just need to play through your pain and continue doing what you're doing while taking non-steroid anti-inflammatory drugs like ibuprofen and Motrin and icing your shoulder regularly. Thank you for watching this informative video on rotator cuff injuries. If you believe that you have one of the injuries I discussed, or you have more questions, then you should contact your athletic trainer or your healthcare physician, and they can further direct you for better assistance.